Okay, so our topic is ASD and seizure or epilepsy. ASD and seizure epilepsy. ASD is a spectrum disorder. It is a developmental disability in a spectrum that can cause significant social, communication, and behavioral challenges. Seizure, on the other hand, occurs when there is an abrupt change in the brain's electrical rhythm, such as that the neurons in the brain become abnormally synchronized. Seizure is the most common comorbidity that is associated with ASD. There is a larger percentage of individuals diagnosed with ASD that experience seizure. Autism spectrum disorder is associated with a higher rate of seizures and epilepsy. Epilepsy is a brain disorder pronounced by recurring seizures or convulsions. Experts propose that seizures may be due to some brain abnormalities associated with autism. These abnormalities may disrupt neuron in the brain, causing changes in the brain activity. Neurons are cells that process and transmit information and send signals to the rest of the body. So, overloads or disturbances in activity of these neurons can result in imbalances that cause seizures. Seizures can begin at any age. Characteristic symptoms include unexplained staring spells, stiffening of muscles, involuntary jerking of limbs, facial twitching, unexplained confusion, and severe headaches. For the less specific symptoms, that would be sleepiness or sleep disturbances, marked and unexplained irritability or aggressiveness, and regression in normal development. So, do autism and epilepsy share genetic risk factors? According to studies, yes, evidences suggest that autism and epilepsy originate from common genetic origin. A study in 2013 found significant overlap between genes linked to epilepsy and to those tied to autism. Also, a theory for overlap is that both conditions share common biological mechanisms. In typically developing children, seizures tend to resolve within a year or two, starting with medications, while children with ASD tend to have seizures that are difficult to treat or that do not resolve spontaneously after a few years. Children with ASD and epilepsy tend to have more medical and behavioral problems as well. For the effect of seizures across lifespan, there is an estimate of 45% of individuals with ASD. They are affected by seizures when they reach adulthood. 12.5% is the average prevalence of epilepsy in children with ASD, 2 to 17 years. In a multivariate regression model, only age and cognitive ability were independently associated with epilepsy. Um, Epilepsy is associated with older age, lower cognitive ability, poor adaptive and language functioning, and children aged 10 or older had 2.35 times the odds of being diagnosed with epilepsy.
So in terms of how to diagnose epilepsy in children with ASD, there's a certain procedure that they follow. They begin by looking at the history of medication that that individual took, and they follow that with discussing the details of where the seizure took place. So the setting, the time, the participants, and all of those kind of characteristics. And then they see if the symptoms related to the seizure activity were provoked or unprovoked. And there's also a protocol after the initial seizure, and they begin by giving the individual a physical and neurological exam. And that is then followed by an EEG to see the risk of the seizure recurring. And then they see the need for an MRI. So, in terms of treatment for epilepsy for individuals with autism, it is a very complex topic. There's a lot of research that is needed. However, the most common treatment is pharmacological treatment, vagal nerve stimulation, and surgery. There is a combination of psychosocial and pharmacological treatment, which is necessary. However, a lot more research is needed. Psychosocial treatment, such as speech therapy and occupational therapists, can help individuals with ASD and it can help control the symptoms. However, it does not necessarily help with the seizures itself. So for individuals with autism spectrum disorder, AEDs, which are anti-epileptic drugs, multiple ones are used to see which medication or combination of drugs is most effective. AEDs are chosen based on the type of seizure the individual has, comorbidities, and as well as side effects of the specific AEDs. When deciding on a specific medication, it is important to consider the interaction of the drugs between the epilepsy medication as well as the ASD symptom medication.
So to finding the epilepsy in teens and adults with ASD is to seizures remit in about 50% of patients during adults. And also it's difficult to arrange schedules to make an appointment or classes or something like that. And locating space for transition clinics is hard for them. Some programs need extra funding for special services, and the high chances of social quarantine and limited education is also hard for them. And there are some ways to improve challenges in adults with epilepsy is transition from school to child to adult program should start early and should be tailored to the level of disability of epilepsy. And there are some supporters for adults like transition working group like TWG created by Ministry of Health and Long-Term Care.
So, in conclusion, to sum up everything we've discussed about this topic, ASD and epilepsy are commonly associated with one another since they are proven to be genetic. Um, the studies show that the cause of epilepsy may be from the brain abnormalities associated with autism. For treatment, there is a lot more research that is needed. However, the most common treatment is pharmacological treatment, surgery, and vagal nerve stimulation. AEDs are commonly used to assess the medication for the individual with ASD, and there are many ways to support these individuals with epilepsy beginning from teens to adulthood. So these are all the references we used. We tried to include information from different aspects on the topic, and we were able to learn a lot from all of these references, and we hope that we were able to share all of this with you. And thank you for listening.